Dr. Storey here, Springs Chiropractic Health, talking about the 3 phases of healing. We're in part 2, the repair phase. Pain, and this is part 2. You might ask the question, what does repair phase have to do with pain or an inflammation? Well, the thing is that once we get into the inflammatory phase, which we just talked about, 0 to 72 hours of that happening, the next phase is the repair phase, in which it occurs between, just after the inflammatory phase, 6 weeks to 12 weeks. What happens here is that there's 2 important processes. Collagen and the nerve around the collagen, what happens. As I've explained this in a different video, it's kind of like a sloppy mop, if you will. If you just lay it down, the collagen starts to just map over each other and just becomes a chaotic mess, if you will. 70% less elastic, so elasticity decreases, strength and mobility decrease. And when we talk about mobility, whether it be with the collagen fibers itself or within any joint, we lose something called GABA, or the neurotransmitter inside our bodies, which reduces pain. GABA is something that puts out there and is produced in the body when joints move. When we lose that mobility or joint motion, we lose GABA, and therefore we have pain. GABA inhibits pain. Now, when we start talking about these collagen fibers, there's not as structured as they were when we first were developed as a human being, and now when we have this injury, it's just mapping all over each other and just a chaotic mess is how I put it. Less strength, less mobility, and less elasticity. When we have those combined, we create painful enjoyment activities that once we could have done, okay? Or we've done before, and now it hurts because now we've occurred this injury, minor trauma or even major trauma. Now, what happens is that how we can get rid of that pain is through active ranges of motion, passive ranges of motion, and even joint mobility or joint motion, which is going to allow more stressors involved to help align the collagen fibers, decreasing the lowered threshold on the peripheral nerves that have been damaged through this process, and now we have a better facility of acting better because we have joint motion, more joint motions through this process of active, passive, joint motion mobility through chiropractic adjustments and even rehabilitation. And those are the process, and the results is basically we improve and we heal quicker through those processes of stressors involved, aligning the tissue, aligning the collagen fibers, and decreasing the peripheral nerve damages which have been done to the injury. I'm Dr. Storey. This is Springs Chiropractic Health. All the best to you. If you have any questions, feel free to reach out to me. SpringsChiroHealth.com. All the best.